There's no doubt dentistry is a rewarding career. You get to help people and provide solutions to their dental problems daily. But just like any other profession, dentistry is not for everyone. Hello everyone, my name is Dr. Koso, and in this video I'm going to be talking about 5 types of people that should maybe not think about dentistry as a career. Please stay tuned. Okay, dentistry is not for you if you are squeamish about blood and saliva. Surprise, surprise, there's blood and saliva in the mouth. While dentistry is an amazing art and you get to do all of that beautiful artwork, it's all happening in a very confined space in the mouth, and that comes along with blood, saliva, and sometimes blood splatter and sometimes saliva splatter. But that's why we wear all the PPE, the face shields, the goggles, the masks, the gowns. But you know, there are just some people that cannot stand the sight of blood and the sight of, I guess, saliva. And if this is you, then maybe dentistry is just not what you should be thinking about. Number 2, don't think about becoming a dentist if you just don't want to be in school for long. The road to becoming a DDS or a DMD is a really long and challenging road, very rewarding, but like I said, very long. It's at 4 years of high school, at least 4 years of college, and definitely at least 4 years of dental school. And then if you want to become a specialist, there's even more school after that. So once you're done with college, your friends will go off and get jobs and start earning real money, and you'll still be in school. And that's something to think about. If you feel like you don't want any more school after college, then dentistry might not be the right one for you. The third type of person that maybe should not think about becoming a dentist is someone who's not a people person. So a people person doesn't necessarily mean that you have to be an extrovert. You can be an introvert and a people person. A people person just means that when you're one-on-one with the patient, you're able to communicate properly with them, you're able to calm them down. A lot of our patients are anxious about coming to the dentist in general, and so your presence and bedside manner, being able to talk to patients, being able to calm them down, being able to explain to them exactly what's going on is very important. Now, while you don't necessarily need to have all these skills before coming into dentistry, because you pick up a lot of these skills from dental school and just practicing in general, you still kind of need to know what type of person you are. If you're just generally anxious about being around people, or you know, maybe you just lack confidence in general, then maybe dentistry is not the best career for you. One more thing, especially in public health dentistry, you have to be extra empathetic. Of course, you have to be empathetic in general, but when you talk about public health dentistry, these are generally patients that are low income. You're most likely their last resort, and a lot of patients are begging you for help. You need to be able to talk to them, relate to them a little bit on their level, so that you can provide the necessary care that they need. And that's one other, you know, facet of becoming a dentist, that, you know, if you're not an empathetic person, or I guess you can't really put yourself in a patient's shoes when they're in pain, that might be more of a challenging career choice for you. Number 4, don't think about becoming a dentist if you think that's just automatically going to make you rich. I mean, I know people think dentists are just generally rolling in money, which for some dentists it's true, but dentistry is not really where it used to be a couple of decades ago. I know that dental school has become more and more expensive. I made a video talking about this, and I think the return on investment is just not what it used to be like 20, 30 years ago, when we hear older dentists talking about what it costs for them to go into dental school. And so if you think becoming a dentist is just going to make you lots of money, and that's the sole reason you're becoming a dentist, that might not be the smartest thing to do. I do agree that dentistry provides you with a pathway to become wealthy, but it's not without a lot of debt, most likely, and a lot of hard work. And so if you think dentistry is just going to automatically make you rich, I feel like you're probably better off looking into other career choices. With the amount of time you spend in dental school, where you could be making money somewhere else, if that is your sole reason, I think you need to look somewhere else. And the 5th type of person that should not become a dentist is someone that just doesn't want to take on any type of leadership role or huge responsibility. By becoming a dentist, automatically in the dental world and in the dental team, in your office at least, you're just automatically becoming a leader. You're automatically placed in that leadership role because everyone under you is kind of depending on you, and basically you are running the show. And so if you just don't want to be a leader at all, and that's fine, not everyone wants to be a leader or can be a leader in that sense, and you just like direct instructions and like to take someone else's instructions, that's fine. But dentistry does require you to have some type of responsibility, a lot of responsibility, because you're responsible for everything you do for your patient. You're going to have to tell your assistants what to do. You're going to have to help with your hygienist what to do. You might have to manage your front desk. Even if you don't own the office, you still are in that position automatically because you're the one that's doing the procedures mainly. So those are the 5 types of people that I think may not want to become a dentist. If any of these apply to you, obviously, you know, it doesn't mean that you should not at all, but you might want to reconsider your interests and what's leading you toward dentistry. I highly recommend shadowing a dentist if you're thinking about becoming a dentist, because it looks one way on camera and it looks one way in all the blogs and everything you read online, but until you're in an actual office following a dentist and watching exactly what they're doing, asking them all the questions, you don't really get a sense of what we actually do. So if you're in high school or you're a pre-dental student, or you're just thinking of a career change, definitely shadow a dentist. Don't just shadow one, shadow a couple so you can find out different styles as well. Thank you so much for watching this video, and if you have not subscribed, please do so, and also like the video. See you in the next one. Bye.